with the design that I asked for, and they delivered wonderfully for it. We had the square, so that's anti-rotational with rounded corners and a big groove on there. It was very precise and had no rotation or movement of the milled ceramic crowns that went on that.
Dr. Sorensen, thank you for joining us today. We appreciate it. We'd like to ask a few follow-up questions. One is in relation to the jaw relations, and there were several adjustments you made in this case. What techniques can you use to get a better vertical initially?
Well, it's kind of a area or a zone, so especially in the edentulous patient, right? So it's a lot more predictable if the patient is dentate. We typically do some pronouncing some sounds. So one of those is, as Earl Pound said, let S be your guide. And when the patients are doing their S sound, like they're doing the 60s, then they will have the most anterior-posterior movement, right? And they'll have vertical, but what you can do is analyze that, and class 1 jaw relationship is 1 or 2 millimeters. Class 2 is 2 to 10 millimeters. My record is 12. Ding, 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 red flag, because class 2 jaw relationship patients are always the most challenging by multiple times. And then a class 3 is almost no movement. They're vertical chewers, so usually very simple for those patients. Using that, and then also doing the fricatives like the 50s, the incisal edges of the upper teeth should be touching at the wet-dry border of the lower lip. So those kind of get you into a general region, and if those factors are there, then I can start to think about closest speaking space, and denture concepts like that. And then, as we were discussing today in my presentation, then we would test that out either in a wax rim if we're doing dentures, or if I'm doing copy dentures, so the patient has dentures they present with that are reasonably good, and we're going to turn those into a one appointment where we're going to be doing a wash impression. We can also use those diagnostically as try-in teeth, analyze the vertical, closest speaking space, and centric relation for those.
During the fabrication of this case, the Tiber case, the bridge lap design was used for tissue contact. Will this design have any impact on the patient's long-term overall oral hygiene?
Mm-hmm. Yeah, good question. So I'm going to say that we typically make a differentiation between the mandibular arch, which we typically are not concerned about aesthetics or phonetics. So we will typically make more or less a hygienic type of antaglios surface. For the maxillary anterior, several of the problems that we could potentially have on the maxillary arch is that if we are not, we'll say, kissing the ridge on there, or we have a space, then the patient can have bubbles coming out of there, and on their plosive sounds and things like that, they get air coming out through there. So I would say we're kind of cheating a little bit, but again, as I was showing you with that special, I think it's Tepe, T-E-P-E, that special brush, it's made in Sweden. It works really good for my patients. I've been using that for like 20 years to get in there from the lingual and clean that up. So on the facial part of the ridge, I'm going to be just barely contacting. You can get floss, more than floss through there. It'll slide through easily. But then as I go out to the more towards the palatal direction, it will be open enough up that the patient can get in there and clean with the brush, or a proxa brush if they want to do it. But again, this one brush works very efficiently for doing that. And so that's the consideration. Then the other thing is, as in Tibor's case, where his posterior implants were way forward because of his sinuses, when you are making that milled bar with the zirconia superstructure that goes down there, you want to make sure that that antaglio surface is very smooth in there. So in the case of what the B-Smile technical team did for me, they made very precise. I mean, I could cut paper with that. You know, it was right in there very, very nicely. So I think that shows the accuracy of the CAD, the design process, and then with your milling machines, just how beautifully the metalwork was perfectly adapted in there, and to the contours of the zirconia, the we'll call it the marginal gap was probably less than a normal crown, so it was very high precision. So I'm not really too concerned. Again, as long as things are polished and smooth, both the ceramic and the metal, then I'm not really too concerned about that.
Dr. Sorensen, could you share your experience and overall impression of B-Smile so far?
Yeah, I would say so far, I've been pretty impressed with the quality of the implant components, kind of everything above the implant. So I have no experience with their implant, but with their abutments, impression copings, and attachments, I've been very impressed with those. I was super impressed with the quality of the design, as I was saying in my presentation, with the milled abutments. So we have that precision milled interface, and then that cylinder of titanium. It allows you kind of unlimited flexibility to design, make anything you want. And with the design that I asked for, and they delivered wonderfully for it, we had the square. So that's anti-rotational with rounded corners and a big groove on there. It was very precise and had no rotation or movement of the milled ceramic crowns that went on that. And I like some of their new innovations in their impression scan bodies. And so I've been very happy with the quality of all the abutments and everything above the implant so far. And then I also have come to really appreciate the nice inherent optical properties that we have with the Ancona 3D Master milling disc as well, with that very unique property of having 6 different layers in that, and then having gradients of strength and translucency and chroma in that. It really makes for just really natural appearing inherent translucency and that gradient of going from dentin to enamel on there. So I think I'm pretty excited about that.
So what's your understanding of the digital workflow? And I mean, you have a lot of experience with this, right? Where do you see it going? Where do we go next in this industry from a standpoint of, you know, right now we're using zirconia and we're still using some titanium, and we're milling, doing a lot of things. If you had a crystal ball, where would you think we were going as an industry as far as digital workflow?
I see maybe in the next 5 years improvements in the scanners. That's kind of one of my beefs, is got the stereoscopic, the dice on there, but that doesn't give me the relationship to the gingiva. So I use this $40,000 or $35,000 device, and then I scan it with my Trio system in order to get the tissue contours, and I see kind of improved optical properties and accuracy of those systems. So, and for one of my master's degree students, for her master's thesis, we found very high accuracy for the 3-shape. It's probably the most accurate system for full arch, long distance scanning between the scan bodies on, like, let's say, all on 4 configuration. So I see that there will be enhancements in that, as well as the software that makes things work better. The printed materials are getting better. I'm feeling pretty comfortable using those for dentures. I don't think we're there yet in terms of definitive fixed restorations. But there's a lot of work going on with a lot of companies, and I think that's probably going to be kind of the next big breakthrough. I don't know if it's going to be in 2 years or 5 years, but I think we'll be there. I don't think we're going to be replacing milling for a while, both because of the accuracy, and the durability of the ceramic materials versus the polymer materials, and stain resistance and wear resistance and just physical properties are still quite a bit superior for the ceramic materials. But I would crystal ball that. I think that's definitely going to be a big area coming up there.
Very good. Well, I just want to thank you for your time today. Thanks for the presentation, and it's been a pleasure to talk to you.
My pleasure also. Thank you very
Thank
much.
you.
Okay.